moved to Clarkston in 2017, spent about a year just listening and learning. We didn't want to just come in with any type of just solution. This is what we're going to do, but we wanted to get to know people. We wanted to be neighbors first. And while we were there listening, there were just these needs that kind of kept coming up about, what the community wanted. And those needs were, they wanted a place that was close by or someplace that was walkable. Many people in Clarkston don't have multiple cars, or if they have one, or maybe the husband's taking that to work. And so there's a lot of people that walk to get around. And so the second thing that people told us that they needed or wanted was a place that offered interpretation, right? I mentioned over 60 languages in that area, but there's a big need for medical services that are sensitive to the linguistic needs of the people it's serving. So a place that you could go to the doctor and be understood, right? The third thing was a place that was open consistent hours. And so a place that people could go to and rely on that was going to be open 5 or more days a week, for example. And then lastly, a place that had price transparency. So as you know, we live in this U.S. American healthcare system where it's a confusing mixture of insurances and deductibles and co-payments and fees, and sometimes that's going to be really hard to understand. But they also wanted to be very clear on what they were paying and what they were getting. So those were the 4 things that we heard.
Right.
And those were kind of the foundations for kind of how we designed Ethne.